Like with children, I have a little colored sand, 2-minute timer. And I just tell them to, floss, load the toothbrush, make sure all the sand's at one end, and then flip it. And they're to brush the whole time. And just getting them to do that, giving them a little toy, so to speak, can make a big difference, because then they're brushing for 2 minutes.
I love that sand timer. Should you brush your tongue? Tongue has germs?
Absolutely, yep. The tongue can become coated, and then the coated will grasp bacteria. So
what makes bad breath?
It's very important. A coated tongue.
A coated tongue.
Absolutely, yeah.
All right. Because some people you sort of
because
back off.
plaque is bacteria, and it's in our mouths, so it's going to stick wherever it can. And
is
your
the
tongue,
mouth the dirtiest area? Then it is really.
I've been told that.
Yeah. Now, so okay, I'm back in your chair, and you've done this, the trace. What happens next? What do you do next?
Then I do the cleaning.
And what does the cleaning consist of? When you say
The
cleaning?
scaling. Like I explained, the smooth edge is by the gum.
Yeah.
The cutting edge, the sharper one, is on the enamel, and that's how we remove.
Do I feel
the
it?
tartar.
Is it painful?
If your gum tissue is relatively healthy, and you shouldn't.
And you shouldn't
No.
bleed on the gums when you're working on them.
You may a little bit, because usually by the time you're due for a cleaning, there is a little bit of inflammation.
Okay.
But
it's nothing to be worried about.
Right, absolutely, yeah, no.
So you're busy taking everything off. It depends on how long
And that's
it takes.
when you mentioned the suction.
Yes.
That's when, as I'm cleaning, I will rinse and suction as I'm going along.
And what teeth are hardest to get to?
Wisdom teeth.
Is that
People
right?
that still have their
third
third molars, they're so far back that they're unable to keep them really clean. So getting behind them usually is a lot of tartar, and it's important that I clean it out, and it can be one of the hardest.
I probably should ask Dr. Wolfert this, but should wisdom teeth come out? Should people keep them in?
Most people should have them out.
Yes.
We just don't have the room in our jaw for them.
And what are they for? They come when we're...
Originally, those are third molars. In prehistoric days, we had fourth molars.
Ah.
So as evolution, our foreheads got bigger and our jaws got smaller. We're down to third molars. You get first at age 6, second at age 12, third around age 18. Now, a lot of kids we're seeing don't even have them, or they may only have 1 or 2. And that's because they are becoming extinct, because we don't need the third molars anymore. Just like
So nature's
way
just-
back when
Yeah.
we needed 4 molars, because
Maybe to eat buffalo.
what they were chomping on, but
Right with a bone.
exactly. So, it's interesting to see the younger generation that they're not all getting third molars, but they definitely don't have the room for them. You can see they're impacted sideways, and
Why aren't they
it's
been taken
important
out by the dentist? I mean, would think...
most kids are. Yeah.
Yes. And
Oh,
Dr.
yeah.
Wolfert pulls them. You pull them.
Usually we send to an oral surgeon.
Okay.
That's the
That
best
makes
way.
even best
'cause,
sense.
Yeah.
Yep.
They're so
'Cause
skilled at it.
Chase came home with, and they're iced and painful.
For a few days.
Yep.
Yeah. And I know he had Dr. Colton,
Yes.
who's very good.
Yes.
I mean, boom, they're in and out.
Out.
They're so skilled at doing it. They do it all day long. So the less trauma, the less swelling.
What about if I come bring my child to you with braces? Can you clean braces? Can you
Absolutely.
Can you
It's very
really?
important.
But
Because,
how? You could get into them with your picks and all that?
oh, absolutely. We just go, where I'm working is that space I keep referring to.
Yep.
So the braces are usually in the center of the teeth, so you can easily get up and around. And it's very important with the braces on that they maintain good oral hygiene, because what can happen is once the braces come off, then they have a mouthful of cavities.
A mouthful of
Because the
cavities.
plaque was sticking and they weren't removing the food that gets caught in the wires, and
How long do you keep braces on for? Usually a year or so, don't you?
every
Even
case
longer?
is different.
Different. So you don't take
know.
you don't take them off. I mean, you're just cleaning
I
around
just
them.
clean around them.
And do you see a lot of plaque and junk? And I would think it'd be awful because the
Some,
food.
but most kids, because they're going every month to the orthodontist, and they look, and if the
And-
gum tissue's really swollen and it's a mess, they'll say you need an extra cleaning, and then we really try to educate the patient that you
How-
really have to work extra hard
How
when you
s-
have braces.
How soon should a parent bring a child into a dentist? Early? Year,
I
2
always
years?
say age 3.
Age 3.
I
And
have
cleaning
heard
at age 3?
them saying babies, but personally, I think age 3. By
Like a-
age 3, they should have
All their teeth
3.5. They should have all their baby teeth.
in. And do you, will they sit at age 3?
They do. It's we make it a fun
Thing.
ride in the chair.
I'd like that.
The suction is Mr. Thirsty.
Isn't that?
The polish, which after the scaling, I would polish everyone's teeth.
Do you really?
With
Now,
the
what does
little
that
ones,
mean?
I just kind of lightly go around, barely touching them, just to make sure there's no plaque. Children, little kids don't get that much plaque
No.
to begin with, but just to get them used to the idea. Then I use the tooth tickler, which is the polish.
Okay,
And I
how
usually
lovely.
do it on their finger first, because it makes a noise, so I don't want to startle them, and it tickles. So then they're all excited to get their teeth tickled.
Tickled.
And of course I tell them how shiny their teeth are going to be afterwards. So then
And they are.
they like it.
And they're.
And then they get, and I count the teeth.
Oh, how many teeth?
They should have 20,
20.
yes.
And then what will happen to those 20 teeth?
They will eventually all fall out.
And then
Yeah.
we get a permanent
The
teeth.
6-year molars come in behind the baby teeth. So those can be coming in while these front teeth are falling out. These are usually the first to go, are the front bottom teeth. And I don't know if you remember, those are usually the first 2 they get.
When you, do you ever see, people have TMJ, they have a lot of, what happens there with the cleaning? Is it more difficult? Or I have a small jaw, so opening it is, and I have TMJ, so opening it for dental
long
hygienist
period
is
of time.
Time, as painful as can be.
Yeah.
And so I have a
you-
little block that I lean on, because, oh, does that hurt?
a bite block?
Yep, because does that hurt to keep it open?
Oh, that's too bad.
And my mouth is
It's
tiny.
a very difficult
Well,
thing to
sure,
treat,
yes.
TMJ.
Oh, I click and everything and
Unfortunately.
sleep. Mouth guards, do you recommend mouth guards when people need it? Can you tell from a cleaning if a person's been grinding?
I can tell if a person's been grinding.
Because their teeth are,
A lot of times, I know my husband,
yes, you can hear them
flat.
anyway.
They're completely
flat.
Flat. And I have heard them several
No,
times.
I can, because it makes, I
Stop it.
grind, I sleep with a mouth guard.
Oh, you do?
Yeah, not a pretty sight.
Yeah, he won't wear it.
Oh, because I'm grinding too.
And yeah, that's ideal, is to get a
Yes.
mouth guard so you don't do any
My
more
dentist
damage.
said to me, "Why are you grinding like this?" I said, "I'm Jewish." He said, "What has that got to do with the price of rice? I have loads of stress. Did you hear?" Oh, it's funny because I do grind. Now, when they leave you, do you give them a packet of goodies?
Yes.
What do you give them? Toothbrush,
The
toothpaste?
swag bag.
Oh, okay. And what's in that? Teaching
Floss.
Yep.
Floss, toothpaste, and toothbrush, depending upon the size
like
of their
it?
mouth.
Mouth.
Some people need a smaller brush.
Yes.
Some people want a bigger brush. And then I'll usually throw in some coupons for Listerine.
Oh, good. So, what kind of toothbrush do you recommend? We know you like the Sonicare for the electric,
Yes.
and you like Listerine. That's wonderful. They're going to have a run on it. And what about the other? What do you like for a toothbrush? Any particular
Soft.
one? Soft.
Soft bristles. That's so important.
Why?
People, I have seen more, myself, I have, before I was a hygienist, brushed away my gums, literally.
Is that right?
Because I had braces and I brushed above the bands and below the bands, and back then, thinking a hard bristled toothbrush was a good thing, which it wasn't. But yeah, people have toothbrush abrasion is what I've seen. And then once the gum tissue has gone, what I've seen is they literally, the root is very soft. So once the root is exposed, it's more susceptible to decay, for one, but I've actually seen people literally almost like they're sawing down a tree and brush a groove in the root surface.
What can happen with that? I mean, must be painful.
Right, and weaken the tooth.
Can you
So-
tell when you're looking at the mouth, to tell Dr. Wolfert later, there's a cavity or this or that?
Absolutely. When we take x-rays?
Yeah.
Right.
And can you spot it anyway without an x-ray, Elizabeth?
Sometimes. There's a lot of, this is why we need the x-rays, because there's so many areas like in between the teeth. Looking in the mouth, we can't see what's down in between the teeth. You know, the surface we can go over with the Explorer, and if it's soft, like I said, enamel's supposed to be really hard. So if it's sticky and soft, that's a cavity. But if you're not flossing, in between the teeth, you could have two cavities, one on each side, because you're not getting in there and removing the plaque.
Do genetics play a role in
They do. They really do.
you? I mean, I think my
I
sister-
think, from what I've seen, and I've also noticed different cultures
That's right. We have
have better teeth.
Is that right? What cultures is that? Any-
Italians
Ah, that's so.
have good teeth, and they have better care. Unfortunately, Irish,
Don't.
well, they don't have as good care in Ireland, and quite often they have small jaws, which leads to crowding, which leads to decay.
Okay.
So there's a number of reasons.
That I know
But-
I haven't had great teeth, neither of my sisters over the years. So maybe ethnicity has something to do with it.
I
And
think so. I mean,
and-
genetics has a lot to
to
do with everything.
Yes. But
Yeah.
isn't it wonderful that we come to you every 6 months so we know that you take care of it, you look at it, and so and you have to come back. It isn't just that initial. I'm back all the time
Right.
because I think it feels so much better.
Oh, they do.
And,
It
and the
feels so
plaque and the
good.
junk she takes off.
I mean, it may not feel good while it's being done,
Done.
but afterwards,
Yes.
it feels really good.
Yes.
Yeah, and it's so important, like I said,
And you love
your
what you do.
overall health. I do. I really enjoy it.
And so, Elizabeth, people wanted to get to you. When are you there? I know the office is open, but when do you work?
I work Monday evenings, afternoon and evening, and all day Tuesday and Thursday.
Excellent. I would ask you, so they have to call. What's your number? We have about 1 minute left, okay? What's the number to?
781-335-0604.
Elizabeth, I cannot thank you. I'll go to the movies with you again. We've been to
Yes.
the movies a few times.
Yes.
Hingham, and I think we went to Hanover once.
Absolutely.
Nikki brought some stuff, water and everything,
Oh, yeah,
and popcorn.
she brings the supplies.
Yeah, supply, and we saw wonderful pictures. It was marvelous. It
Yep.
was a wonderful
We'll do it
treat.
again.
We'll have to do that. Absolutely. I'll call her when I get home.
All right.
She's excited. She left me the name, how to spell it, and everything. She was excited you were on. I cannot thank you enough. What would you leave people with? Go to the dentist,
Absolutely.
and do your cleaning every 6 months. Get Listerine, Sonicare,
Floss.
and floss. And floss, you liked what?
Glide.
Glide, and also a soft toothbrush.
Yes.
That is wonderful, wonderful, wonderful advice. So,
Okay.
we will see you down the road. You'll come back again and again and again?
Sure.
Okay. You can't hesitate. Bye-bye for now.